Hello, everyone. Thank you so much for being here. We're going to be allowing a few seconds so everyone can join us, and we will be starting really soon. Okay, so we are all here today. Thank you so much. To hear today's presentation in Spanish, please go to the Interpretation tab on your Zoom panel and click Spanish. You can also mute the English speaker's voice, clicking mute on the original audio. Now, we are going to be reviewing a few housekeeping items. Today's event is going to be recorded and it will be made available publicly through our website and other media channels. For today's webinar, all participants will be muted. Please make sure your computer speakers are turned on, up, and to hear today's presentation. If you are having technical issues, please send a message to the Hispanic and Latino Behavioral Health Center of Excellence on the chat box. If you have a question for our presenters, we ask that you use the question and answers tab on the toolbar. Simply type your question and hit send. We can address the questions to the presenters at the end or at the appropriate time during today's presentation. We will be sharing a copy of today's presentation in PDF format through the chat. And we will also make a copy of today's presentation available to be downloaded through our website. You can also find it under the name of today's event. A recording of today's webinar will also be posted on our YouTube channel. Now, please, at the very end of this presentation, please complete the evaluation. The evaluation will help us know more about your opinion and thoughts about this presentation and what topics and trainings would you like to see offered. A link of the evaluation will be shared through the chat too, and you can also scan the QR code at the end. Our mission is to advance and support the sustainability of behavioral health by promoting community-driven, culturally grounded, and person-centered prevention, treatment, multiple pathways of recovery, and recovery support for Hispanic and Latino communities. And we strive to accomplish this mission through the development and dissemination of culturally informed, evidence-based behavioral health information by providing training and technical assistance, and also supporting the growth and expansion of the behavioral health workforces that serve the Latino communities. Today, we have Dr. Esther Calzada as our presenter. Dr. Esther Calzada is the Norma and Clay Levin Professor in Child and Family Behavioral Health and Associate Dean for Research at the Steve Hicks High School, the Steve Hicks School of Social Work. So sorry about that. She received her bachelor's degree from Duke University and her PhD from the University of Florida. Dr. Calzada is a clinical child psychologist with expertise in parenting and early childhood development in Latino and other minoritized families. She has a strong commitment to scientific equity, working to both elucidate and counter systemic injustice that undermine healthy development and recognize and leverage factors that promote the well-being of young children. Ultimately, her program of research aims to reduce these academies in achievements, behavior problems, and social-emotional problems. Her work has been founded by the National Institute of Health, the U.S. Department of Education, and the National Science Foundation, and is published regularly in psychology, educational, and medical journals. Dr. Calzada holds current faculty affiliate positions in the Population Research Center and the LLILAS Benson's Latin America Studies and Collections, as well as the Department of Mexican, American, and Latino Students. She served as Associate Dean and Inclusion when it comes to Steve Hicks School in Social Work and as a Director of the Texas Center. Now, to not delay more this presentation, we are going to be starting. So I'm going to leave Dr. Esther Calzada to begin the presentation and let us know more a little bit about her while she does, okay? Thank you so much, Dr. Calzada.
You for the introduction and for the opportunity to be here today. I'm looking forward to sharing some of my work and being in conversation with you all about Latino families and how we might best support them. So I'll start by sharing what we're going to do today, a couple of agenda items, and also the underlying commitments that I've made in my work as a scholar. So today I'm focused on two goals. The first is to advance empirical understanding of Latino parenting, grounded in contemporary theoretical frameworks. So I'm going to be sharing research that I've done that allows us to better understand Latino parenting. And number two, to think about the implications of that research for prevention and early intervention with families of young children, Latino families of young children, with the goal of promoting behavioral health in youth over the long run. So underlying those goals, I have made some explicit commitments to myself as I have advanced in my career and thought about my identity and my goals as a scholar. And I just want to name that my commitments are to challenge stereotypical notions of Latino parenting and of Latino children and youth. There is a lot historically that we have assumed about Latino families that we have not looked at from a research perspective, and that have been deficit-oriented and stereotypical notions of families. And one of my goals is to think critically about what those stereotypes are and contribute to a better understanding of Latino families. And my third commitment is to support the development of Latino children and youth, and really thinking about, from an empirical and theoretical perspective, the context in which Latino families are raising children and how we can best support them given that context. So today, I am not giving a research talk, right? But I am going to be sharing some research findings for the sake of kind of setting up my thinking about how we may best support Latino families of young children. And so I'm not going to share a lot about research methods or analyses, but I did want to give you a sense of the communities and the populations that I've been working with through my research, so that you can have an idea of what kinds of communities I'm referencing when I do share research findings. So in this table, you see a list of the studies that I've led, and I will point out a few things about them. So one is that I have done my work primarily in New York City and in Texas, but I've also done work in the Dominican Republic and in Georgia. And so a lot of what you'll hear me talk about is New York City grounded, although it will come from lots of different studies, potentially. Another thing you'll see is that my work has focused primarily on families of young children, and that is typically defined, in my case, as families of kids who are in preschool and sometimes kindergarten as well. But I have done some work with adolescents as well. And then you'll also notice that some of my samples have been very intentional in focusing on specific ethnic groups. And so most of my work has been with Mexican origin and Dominican origin families, although I have done some research that has been more broadly focused on Latino families from any country of origin. Most of my work has been quantitative, but I have done some mixed methods work. And so some of what you'll hear has been informed by focus groups, semi-structured interviews, and/or behavioral observations that I have conducted. Okay, so to get started, I will talk about my interest in parent training and in parenting more generally. So beginning with my graduate studies, I was part of a lab that was focused on implementing and testing a parent training program. And so that was kind of the start of my focus on parenting. Parent training programs started in the 1970s. They're grounded very heavily in both attachment and social learning theories. And they have become, over time, a gold standard approach when we think about ways to help families to address mental health concerns in childhood and academic concerns as well, actually. And from a conceptual perspective, that makes a lot of sense. Because when we think about the science of parenting, right, it's grounded in our understanding that children develop within their unique ecologies. And so I'm sure that all of you are familiar with this image of concentric circles representing the ecological theory. And in the middle of the concentric circles is the child, right? But the child and the parent are right there together, and they comprise the microsystem. And so even though we understand that the child is developing within these meso and macro systems that are inclusive of, for example, laws, societal values, neighborhoods, schools, healthcare systems, etc. What we also know is that the most proximal influence on children are parents. And so one parenting scholar put it like this: parents create people. Amidst the plethora of influences on child development, parents are the final common pathway to child development and stature, adjustment, and success. And so if you think of it from that perspective, then it makes a lot of sense that we would focus on parents if we care about child health and well-being. So my interest in thinking about parenting and parent training specifically was to say, if this is the gold standard approach, what is the evidence of these kinds of programs for diverse populations? And my primary interest has been thinking about that question when it comes to Latino communities and families. We know that evidence-based parenting programs are designed with very broad goals in mind. The first is to strengthen attachment. So in other words, that parent-child relationship. The second is to break coercive patterns. And this is based on research showing that when children are having, especially behavioral problems, that children and parents develop these coercive, tense, conflictual ways of interacting. And it's a very powerful intervention target to break those patterns and move towards less conflictual and more collaborative, safe, nurturing interactions. And more generally, the goal of these evidence-based programs is to reduce authoritarian parenting and promote authoritative parenting. So these goals are grounded in lots of theory and research that has been conducted for many, many, many decades. But again, from my perspective, starting back in graduate school a number of years ago, was what is that evidence, or what do we know about how these kinds of ideas or these kinds of associations are taking place within Latino communities? And so I'm going to talk about Latino parenting and thinking about the intervention lens specifically through a number of empirical questions. The first question that I thought was important was, what does Latino parenting look like normatively to begin with? So if we think about all the research that informed parent training, and we know that the people, the participants who were part of that research were predominantly not from Latino backgrounds, then a baseline for me was to say, well, how can we even understand from an empirical perspective what parenting in Latino families looks like? I knew starting back in graduate school when I was reading about Latino families, and there was not a lot to read, but I knew even then that I was seeing these depictions of families that felt stereotypical to me. Often Latino families were labeled as authoritarian, which meant that families were described, or parents specifically, were described as being very controlling. And they were also described as relying more so than other kinds of families on harsh practices. And so in some ways that resonated. I mean, all of us from Latino communities kind of chuckle at the idea of the chancla and maybe how people who have raised us, use the chancla as a way of ensuring our compliance. But it also felt to me like it lacked nuance, and certainly it wasn't something that had received a lot of empirical attention. So one thing that I have done over the studies that I shared briefly with you about was to look at normatively, what do mothers say, mothers specifically in my studies, what do they say about how they're raising their young children? And essentially what I have found over all of these different data sets is that authoritarian parenting is not common in Latino families of young children. Now, here you see a table from one of my studies. Actually, the study combined data from the Dominican Republic with data in New York City. And what that allowed us to do was to look at what do moms say about their parenting if they are Dominican living in the Dominican Republic or Dominican living in the US. And we were also able to look at differences based on poverty status of the family. So whether the family was living in poverty or not. And so in this somewhat busy table, you can just pay attention to what's boxed out in green. And this is our scale that measured authoritarian parenting practices. I will say that this is self-report of moms. And so we might wonder if there's some bias in self-reporting. But nonetheless, what it tells us is that moms are reporting relatively low levels of authoritarian parenting practices. And that was true in the US and in the Dominican Republic, although it was slightly higher, not statistically significant, in the DR. And it was also true within the US sample, whether families were living in poverty or not. The one subgroup where we found slightly higher levels of authoritarian parenting were moms who are living in the Dominican Republic and also living in poverty. So it seemed like that combination made it so that moms were slightly more likely to use authoritarian parenting. And so this really tells us, and other data sets that I've looked at have been consistent with these findings, that moms in general do not report the use of a lot of authoritarian parenting practices. And in fact, if you look right below at authoritative parenting, they tend to describe that they are using authoritative parenting practices. So what about the gender? I also looked specifically at mothers' self-report of spanking. So if you know about the literature on spanking, spanking is a pretty universal parenting strategy across countries, across groups. It is quite prevalent to spank kids, but specifically during that kind of late toddler, preschool kind of developmental period. And then usually what we see is a pretty sharp and consistent decline in the use of spanking. And that's true kind of across countries and subgroups, as I said, within countries. So we found the same thing. Spanking was somewhat common. Mothers said that they sometimes used spanking. So they didn't never use it. They weren't often using it, but sometimes. But we also saw those rates go down as the children got older. And that's exactly what we would expect. We looked at whether spanking was more prevalent in Mexican versus Dominican origin families and did not see a difference. We did see that mothers of boys were slightly more likely to spank than mothers of girls. So in general, that these are a couple of samples of findings addressing that first question, but there was no evidence from the research that I've been doing to suggest that Latino families are particularly harsh in terms of using spanking or other physical means of discipline, or particularly authoritarian. So my next question has been, but does parenting, regardless of what it is, does it influence kids in the same way if they're in Latino families as if they are in white American families? So in other words, if we think that we want to reduce authoritarian parenting because it's bad for kids, then we need to know that it's bad for kids regardless of which family they come from. For example, a white American family or a Latino family. So across data sets, right? So across the samples that I've worked with and across time points in these longitudinal studies, what I found was that authoritarian parenting is in fact associated with negative outcomes for kids. And that's true in terms of internalizing problems and specifically depression, and externalizing problems. So those acting out, kind of defiant behavior problems that we see in children. And we also found that authoritarian parenting was negatively associated with academic skills, including school readiness, so that families who, or mothers specifically, who used more authoritarian parenting had kids who showed lower school readiness, which is understanding of those basic kind of pre-academic skills that kids need to do well in school, like letter recognition, number recognition, shapes, colors, etc. And we also saw that in families where mothers endorsed more authoritarian parenting, that kids had lower academic achievement test scores as they moved through formal schooling. We were also able to look specifically at spanking and how that was associated with child outcomes. In the figure that I'm showing you here, we looked at it in relation to children's externalizing behavior problems. We were able to, because of our longitudinal study design, to look at how spanking was associated with child externalizing behavior at the same time point, as well as prospectively. In other words, was it able to predict externalizing behavior at a later point in time? And what we found was that spanking was associated at the same time point or concurrently with more behavior problems, but not prospectively with child externalizing behavior. So, what this hints to us is that families may go through a period where kids are acting out more, and parents may tend to rely more on spanking at that time. But that as either the spanking decreases or the child behavior problems decrease, that things will shift. And our research suggests that there are not necessarily long-term negative consequences to the use of spanking. This is something that is pretty debated in the literature, in the sense that many researchers and some professional organizations feel strongly that the use of spanking has pretty serious or at least significant long-term impacts on child development. And here is a caution that maybe we need to continue to research that question, because that may not always be the case. But from this second question, we do see that authoritarian parenting and even the use of spanking is not something that we want to see happening in families, right? Because whether just concurrently or over time, it does appear to be associated with more negative child outcomes. My third question has been, especially with the understanding that authoritarian parenting may be harmful for kids, for if we really are thinking about those optimal developmental outcomes for children, then what are the things that can help us understand why parents use authoritarian parenting? And here we can think from a conceptual perspective about the social context. And so we know that social demographic characteristics of families matter. We know that, first of all, from a theoretical perspective, right? Even thinking back to ecological theory, to the concentric circles that we're all familiar with, we know that all of those broader societal forces shape child development. And so the neighborhood that you grow up in, the schools that you attend, the healthcare clinics that you have access to, all of those things are influential in the development of a child from the perspective of ecological theory. Same from the perspective of social determinants of health framework, right? We know that health is actually predicted not only by your own individual characteristics, your genetic makeup, for example, or something with your physical health. We know that physical and mental health are also predicted by social factors. Do we have economic stability? Do we have access to good education? What are our health systems like? What neighborhoods are we growing up in? What is that broader social context? We know there's a lot of research showing that those social determinants matter. And finally, we know from current theory that all of these things kind of come together in very complex and nuanced ways, so that how these factors converge, right? How our access to education, how our poverty status, how our gender, how our race and ethnicity, all of those things come together and they converge to influence our lived experiences, how we are experiencing everything around us, and thus to influence our health. A theory that puts all of those ideas, kind of those very broad theoretical ideas together in a really nice way to help us understand child development is the integrative model of child development. This is by Cynthia Garcia Cole, and it's from 1996, so it's been a while since this theory came out, but it really revolutionized the research world in terms of child development for kids who came from very different kinds of backgrounds. And here what you see is that Garcia Cole and colleagues are arguing that we understand developmental competencies, that box on the right, number 8. So in other words, all of the things related to how kids are developing, we can really understand that through a number of pathways, but they all originate with social position. And so according to this model, social position variables based on your race, your social class, your ethnicity, and your gender are going to influence how you may experience aspects of segregation, of racism, all of these things that are going to create either promoting or inhibiting environments when it comes to your schools, your neighborhoods, and your healthcare. And so all of these kind of much broader macro level forces are influential in thinking about, well, what's happening at the family level, right? And importantly, what Garcia Cole and colleagues also did was to talk about this concept of adaptive culture. That's box number 5, kind of in the middle of the figure, in which they're arguing that all of those things shape how families and communities adapt and the kind of cultural traditions, legacies, histories, etc. They kind of adopt as they are navigating the social environment that they are living in. So quickly, this is very familiar to all of us working with Latino populations in the US, but the social demographic profile of Latinos in the US is unique from a number of perspectives. So first of all, about 20% of the population in the US is Latino, as you probably all know. And the percentage is higher amongst little kids, right? So in the early childhood population, so kids under the age of 5, more than 1 in 4 kids is of Latino background. We also know that Latinos come from lots of different countries of origin. The vast majority in the US have Mexican origin backgrounds, so almost 2/3, and the next largest group is from Puerto Rico. But we come from all different countries of origin, right? And we're also mostly US born. And most of us are citizens, most of us are documented as well. Still, about half of the population is bilingual. Most of us do speak English, but many of us speak Spanish as well. And then another thing is that we are a racially diverse population. And so if you think about how the US Census collects information about different populations in the US, the category of being Latino or Hispanic is considered an ethnicity. And then the other categories that we tend to think of in that large bucket of race ethnicity, Black, white, Asian, Indigenous, those are considered races. And that's according to the US Census. And so if you think about Latinos, we are a racially diverse population in the sense that we can come from any of those different, or we can identify as part of any of those different racial groups. And so that racial diversity or heterogeneity is something that's very unique to the Latino population in the US. We also know that the Latino population in the US has higher rates of poverty than the national average, especially in families of young children. So poverty rates in general are always higher in families of young children when parents are least able to have lots of work opportunities without considerable childcare costs. And so those poverty rates are high, especially in families of young children. And then also the high school graduation rate is lower relative to the national average in the general Latino population in the US. Here is my New York City sample, just to highlight that our samples generally show what I just presented about the national statistics for the population, I want to point out two things. One is in our research, and this isn't just my research, but if you look at the research on Latino families more generally, we do tend to have samples that are more likely to be living in poverty. Now, that makes sense if you think about the high rates of poverty for the Latino population in general, but also there are many, many, many Latinos not living in poverty, and our research really has not sampled meaningfully from Latinos who are not living in poverty. The second thing I want to highlight is that I mentioned briefly that I was interested in Latino families from different countries of origin. And it turns out that for example, in this case, where I have a Mexican origin sample and a Dominican origin sample, these samples look very different in terms of social demographic characteristics. And so it's really important, one, for us to understand the social context for the population as a whole, but two, to understand that it really does depend on so many different things, including country of origin for families. Okay, so if we connect that social context piece back to parenting, what we're wondering about is how do all of these kinds of social factors relate to how mothers are choosing to parent their children, what kinds of strategies they're using. And specifically, I've been interested in risk factors for authoritarian parenting, since we now know that authoritarian parenting really does seem to inhibit optimal development in young children. So just a few things that we have found, a sampling of things that we've found. Here we know that when moms have limited social support, they are more likely to, for example, use harsh verbal parenting. We also know that authoritarian parenting is more common in the context of stressors experienced by moms. And those include both her own mental health and specifically her report of depressive symptoms that she's experiencing, but also pressures related to the adjustment from kind of a Latino cultural perspective to a more mainstream US context. Here's the figure representing that second study that I alluded to, where there are pressures that or stressors that moms experience in the adjustment process to a new national or cultural context. And that actually includes both pressures to fit in to these new norms, but also pressures to preserve those aspects of their traditional culture that folks from their traditional communities find important. But I show you this slide also to point out that consistently what we see is that actually rates of maternal depression are pretty high for the moms that we work with. So that makes all of this even more significant, right? Because in the context of these social stressors, we also see moms struggling with depressive symptoms. So in this particular study, and these are Mexican-American moms in Texas, 36% reported a clinical range of depressive symptoms. We also know that authoritarian parenting is more common when families are facing poverty. And on top of that, we have found that poverty actually exacerbates the effects of authoritarian parenting on kids. And so not only are you more likely to use authoritarian parenting strategies if you're living in poverty, but also the negative impact of that authoritarian parenting is going to be stronger on your child in the context of poverty. In this case, we looked at this in relation to child internalizing problems. So putting all that together, right, we know we go back to this question of authoritarian parenting is harmful for children, it looks like. And here we're speaking specifically about Latino families of young children. And that's especially true, right, if we think about the context of poverty, vulnerability from a social perspective, and maternal depression. Okay, so here's my final question that I'll talk about today, which is in thinking about all of this research and all of this data that we're collecting to better understand families and how they're doing and how things kind of work within Latino families, how do we use that kind of information to support Latino parents in the US? So over time, I've really come to appreciate the idea that incorporating culture and context is necessary. And so it's very hard for me, looking at the literature, to ignore a few critical factors. One is that Latino culture is distinct from mainstream US culture. Another is that culture and context are dynamic. That is, that culture and context changes across time, across space, right? Depending on where families are, depending on the age of their children, depending on how much time they've been in a certain community relative to another, et cetera. Third, the Latino population is very heterogeneous, and every individual holds their own unique converging identities, so that ultimately social positionality really looks very different for every single person, actually. The Latino population as a whole is underserved, in spite of all these vulnerabilities that we can document. And our science has not really been able to account for all these complexities. So even as I and many, many others are starting to do this research to understand more deeply how Latino families kind of experience everyday life and how they raise their children and what kinds of stressors they face and et cetera. All of this is really complex and it's very hard to capture, especially in quantitative studies. And we also know that disparities persist. And so for all of those reasons, it becomes very critical in my mind to think about, well, how can we get better at thinking about culture and context when we're serving Latino families? So I've kind of come up with a few principles that I use to think about intervention with Latino families. As a side note, I have, from my graduate years, been working kind of in the clinical space, right? Starting with parent training, which I mentioned, and specifically parent-child interaction therapy, which is a very well-regarded, widely used, evidence-based parent training program. And then after my graduate studies on a program called Parent Corps, which I was a part of developing and testing, and which is a prevention program with the idea of bringing kind of parenting information and support into communities. Through all of those experiences, I've been really thinking about, okay, how do we do this better with Latino families? And so here are a few of the kind of guiding principles that I have started to adopt. The first is that one-size-fits-all intervention models are not designed to account for cultural and contextual variations. And so there's a lot of value to those intervention models. For example, picture the very manualized, structured clinical interventions. There's a lot of evidence to support the efficacy and even effectiveness of those programs. But one thing they do not do is account for cultural and contextual variations. Number two, it's really important to broaden our understanding of what we think about evidence, and specifically evidence-based practice or even programs. Evidence-based practice converges at the intersection of three things. The first is research, which is the thing that we think most about, right? Like, was this based on theory? Was it tested through a randomized controlled trial, et cetera? But that's only one of the factors that's important to consider when we think about what is evidence-based practice. A second is the clinical expertise of facilitators. So folks who are on the ground, working with communities, working with families, develop a lot of wisdom and a lot of skill and a lot of kind of insight into what's important and what's effective within that specific community. And that's part of evidence-based practice as well. And number three, actual client needs and preferences. And so what is it that folks actually need? Not what they are told they need, but what they actually need and what do they prefer. And again, we tend to overemphasize research when we think about evidence-based programs in practice and underemphasize clinical expertise of facilitators and client needs and preferences. Number 3, as a guiding principle, is thinking about critical theories and the need to understand individual positionality. So I'm talking here about social positionality based on your social position variables, race, ethnicity, gender, social class. And critical theories also tell us that there's great value in bringing in counter storytelling. And counter storytelling is the idea that folks are in the best position to tell their own stories, and that we really need to find ways to amplify the voices of the families that we're working to serve. And that doesn't only mean, right, very broadly speaking, that can literally mean within our interventions that we are providing with communities. The next one is interventions that build on cultural wealth are really important because they help us counter deficit views that sometimes we are faced with. They illuminate the humanity of the families and the kids that we're working with, and they leverage the inherent strengths of the Latino populations and communities that we work with. And finally, I'm guided by prevention strategies and thinking about how do we intervene and support folks before problems become significant, of clinical nature, and more difficult to treat. And so with that, I'm going to share a little bit about a program that my team and I are developing and thinking about the research that we've been doing and the intervention experiences that I've had over the years and working to best support Latino families of young children. So this program is called Lacitos, and it is focused again on young children and specifically on working with parents to support social-emotional learning in their kids. It's because of my intervention principles, it's individualized, it's strengths-based, and it's preventive. Here is kind of the heart of the Lacitos program. It's called the Ideas Cycle. And the focus here is on the process that we are encouraging parents to follow. And this is a process to promote young kids' social-emotional development. And it really relies on the parent-child relationship, right? So thinking back to parent training programs are really very heavily influenced by attachment theory. So that parent-child relationship is critical here. We consider that the lazo, right? And we want that to really be the driving force for the learning process. You also hear that learning is, you also see here that learning is personalized, and I'll say a little bit more about how it's personalized. But in calling this a cycle, we're also kind of naming the fact that learning is continual and it's iterative, right? So that we go kind of back and forth between these stages, which I'll describe in a second, so that parents really think about just the ongoing continual nature of supporting their children in terms of social-emotional development. And then we also think about learning being fostered by proactive strategies. And our focus here is to really think about how can we set things up within homes and within parent-child relationships so that kids are really set up for success and to really learn as optimally as they can those skills that are so foundational to their lifelong health and well-being. So conceptually, Lacitos is based on self-determination theory, and self-determination theory tells us that people are motivated and engaged when they have kind of 3 feelings, I guess. The first is competence. So that makes sense, right? We are not going to feel motivated or engaged if we don't know how to do something. We need to be able to understand what it is that we need to do, and we need to know how to do that thing, right? So that's just basic, like, think about that as didactic teaching and then giving kids opportunities to practice. The second is autonomy. And this is the idea that when you feel like you have a choice, when you feel like you have a say in what to do and what choices to make, out of all of the choices you can make in any given situation, that really enhances your motivation. And the third is relatedness. And so here, this fits with the idea that we want parents and kids to have a really strong attachment, because it's in the context of that attachment that kids will feel most motivated and engaged. Okay, so I'm going to circle back to the ideas cycle and tell you a little bit about the stages so that you can understand them a little bit more specifically. Stage one was to imagine. So this is the I from ideas. And in this stage, basically what we want to do is we want kids to feel curious about, and that we want them to feel a sense of autonomy and control over whatever the skill or the topic it is that parents are wanting to develop in their child. So again, we're talking about social emotional skills. And here we use parent-child discussions to introduce the skill and to create a shared understanding and a shared language around that topic. So it's very intentional in its use of questions rather than more kind of teachy didactics. And shared decision making. So, what would it look like to make a new friend? And how would you like to make a new friend? Rather than coaching kids on making a new friend, as one example. Stage two is to discover, and this is where we're building that competency, right? Building skills. And here we're using parent-child play and reading to help kids practice the skill related to whatever the specific topic is. So what are those topics? When we're talking about social emotional learning in young children, there's a range of topics that folks are helping kids to develop, and they are related to helping kids understand themselves. So kind of a sense of understanding of themselves, and also kind of control strategies, right? So like emotional control and behavioral control. So common skills that we talk about in SEL programs are understanding ourselves, like I said, but being kind, making friends. What does it look like to be a good friend? Behavioral strategies like following rules, listening, respecting, helping others, cooperating, working things out, so problem solving, and then a lot with feelings, especially in the preschool years. Learning to understand feelings and how to deal with them is really critical for kids to develop in healthy ways in terms of mental health. So despite our focus on these topics within the program and as used in our ideas cycle, Lacitos is really more about the process. It's more about that ideas cycle. And what that does actually is allow parents to emphasize skills that are most important to them, that maybe they have most concern about for their own child, and also in ways that are culturally congruent. So you can imagine very obviously that having a child understand who they are is going to look very, very different for every single child, right? And so it's really important for that to be flexible and organic and really driven by the parent. But many of these others do as well. In some cultures, showing respect means eye contact, whereas in other cultures, that means do not make eye contact, right? And so instead of scripting that, the idea is really that parents are given the autonomy and the liberty and the encouragement to really teach that in the way that makes sense to themselves. And that fits with this evidence-based practice model that I was sharing with you a bit ago, where we need clients, in this case, we need parents really informing us about how interventions should work just as much as we need our research and just as much as we need our own clinical expertise as clinicians. Okay, stage 3 in the ideas cycle is experiment. And this is our focus on thinking about, well, how do you set up kind of the environment of kids, and specifically how parents manage children's behaviors? How do you set that up for success? And so here we think about proactive strategies within a structured environment. So we know from lots and lots of research on parenting in early childhood that kids need structure in the form of routines and in the form of rules that helps them be able to understand what to expect, right? That predictability and the consistency is very important for young kids to be able to learn best. But within that, we also know that when parents and other caregivers, including teachers, for example, use proactive strategies, so they're doing a lot of modeling of what they want to see, they're doing a lot of instruction and narration, they're helping kids rehearse, they're praising and reinforcing the kinds of skills that they want to see happening. When we really focus on those proactive strategies, that's when we are fostering, right, the kind of environment that allows kids to work, to learn best. And so in this case, you can think about parents being able to think about those proactive strategies and use the ones that make most sense to them. So I've done focus groups, for example, where parents will tell me, I don't agree with that kind of idea of reinforcement or praising or whatever it is that maybe I would suggest based on an intervention manual. Well, in this case, it doesn't really matter how you choose to express your proactive strategy, right? It is that you are using a proactive strategy and one that fits for your kind of cultural norms and beliefs. And so this really allows parents to use the proactive strategies that make most sense for them. Our next stage is adapt. And here we are really emphasizing the idea that, okay, you've taught this skill, right, in stages 1 and 2, and now you've set up an environment where your child will be showing you, practicing the skill and getting reinforced for it and getting better at it. But learning can be really challenging, right? Some kids learn faster than others, and in some circumstances learn faster than others. There are all sorts of things that influence the learning process. And the idea here is to really prepare parents for the idea that we're really trying to avoid getting to a point of discipline, of this is a problem, I need to fix it, I need to correct it, and instead really focusing on those proactive and management strategies. At the same time, discipline is always necessary in raising kids. And how do we think about discipline in a very intentional way where we're really reserving it for certain kinds of misbehaviors? So we think about that in terms of like, wow, this misbehavior might be fraying your relationship. What are the things that you can do to guide your child through behavioral challenges? And part of that is checking in with yourself, making sure that you have your own self-control. Part of that is making sure that you're using all of your other strategies, the proactive strategies, those foundational strategies, as well as you can. And then we think about, well, what if discipline does become necessary? What does that look like? And our final stage is here, it's support. And this is the idea that it's really helpful to sit down with kids and reflect on how things are going. You're learning to make friends. How is that going? What's working? What's not working? How can I better support you? What can you do differently, right? That conversation about we can always build, we can always get better with the skill. And sometimes we just need to change the way that we're approaching how we're learning the skill or how I'm helping you to learn this skill. So those are our stages. I'm going to go quickly. I think I'm doing okay in time. And if not, please interrupt me. I'm going to go quickly through just one possible example of how this might look in practice. And this is focused on the topic of understanding ourselves. So we consider this topic really pretty foundational. And that's because that sense of self is one of the first things that develops. It's really influential for the kinds of decisions, the behavioral choices that kids make, also very influential for self-esteem. And so we want to be very intentional in helping parents guide their kids to understand themselves. And ultimately, the goal here, if we think about Latino families, one very important goal is to build a healthy ethnic identity. We know from lots of research that kids are very naturally curious when they're young, and they're curious about differences and about similarities. And so if they see somebody whose skin looks different, whose hair looks different, whose parents look different, who are speaking a different language than they are, they have a lot of natural curiosity about that. And there is not necessarily a positive or a negative valence to that curiosity. But what often happens is that they learn that those kinds of questions are inappropriate or make the adults around them uncomfortable. And so that ends up kind of stifling conversation around who are we, how are we different, how are we similar. And so what we're trying to do is counter that and saying this curiosity is a good thing, it's a natural thing. And when we engage in kids around those kinds of conversations, we can help them feel proud of who they are and also help them understand, accept, and appreciate people who are different from them. So this goes back to this whole idea of how are we building on cultural wealth, right? So understanding yourself and understanding the ways in which you're both different and similar to others around you is a process by which we can think about, like, what is it about our language and our values and our identities that we can really help children understand and appreciate. So if we transfer this to the idea cycle, we can think about helping parents have discussion. And so we can give them scripts where here are some questions that you might engage in. Here are some things that you can do as part of that discussion. And we can help parents think about, like, what if you were to look in the mirror with your child and describe things about yourself, about your child, about characteristics that maybe when they are out in the world, folks are going to comment on or react to, and we want them to understand and appreciate before going out into the world, right? And having those kinds of reactions. And again, also helping them understand appreciation for how everybody is different when it comes to these kinds of characteristics. We can think about then how to help them build that ethnic identity through activities and through books. And so we have recommended activities and we have recommended books. We can think about how they use their proactive strategies. How are they modeling things about their own background, their culture, their ethnicity? How are they reinforcing the beauty and the uniqueness of their own child's ethnicity and culture, et cetera, right? And then over time, making sure that they are supporting that, right? Reflecting with their kid, because especially with something like understanding yourself, we know that changes developmentally, right? And how, for example, if kids move into a new classroom or now they're exposed to a new peer group, things become different about who they're comparing themselves to, how they're understanding those differences. And so making this something that happens over time through reflections also becomes really important. So that's just a short little explanation of how we might see this play out, specifically as focused on one topic. And I'm going to stop there and would love to see if anyone has questions or any topics they want to discuss. Not sure if there's a moderator for this. I don't see any questions in the chat. Oh, there's a Q&A. Okay, there's a couple of questions here. The first one is around the spanking self-report research. And the question is, could it be that participants are afraid that endorsing the behavior would result in a CPS report and hence the reason they might have underreported? Was there anything prior to filling out the survey that may have made the participant more likely to respond honestly? Just wondering if public perception may have influenced the responses. Yeah, so that's a great question. There certainly is evidence that there's bias in reporting on things, and particularly spanking is one where that may happen. Just anecdotally, I remember working in New York City schools, how parents would actually tell me that their kids would come home, and these were 3, 4, and 5-year-olds, and would tell them, that the school had told the children, your parents are not allowed to spank you, and if they do, you should call 911. So there's certainly a lot of public perception around spanking and fear of CPS-related issues, reports, et cetera, that may have influenced this. We did everything we could to kind of mitigate those concerns. This was confidential. It was not anonymous data, but private and confidential data And we explained that endorsing the use of spanking was not actually a mandated reporting kind of event, but it's certainly possible that our self-report data was biased because of concerns around CPS involvement. There's also a question of where can we find Lacitos? And so Lacitos is a program that we have just now developed based on all of the things that I was telling you about. We are working with school districts here in Texas to implement the program. And so it's not officially published yet. Okay, so I don't see other questions. And I'm wondering, I don't know if there is a moderator here. There's a question.
Hello, everyone. Thank
Oh,
you so much, Doctor. Yes, I don't see any more questions. I do know that there might be people that will want to share more information with you, and they can feel free to let us know and to just share the information directly to us, and we will make it, we will ensure that you get it. Other than that, we can still use a few more minutes if there are any more questions, but as of now,
sorry.
the slides are being shared through the chat. I am going to be sharing them again. So you should be all receiving it in a few seconds.
I'm not sure if somebody was asking me a question I couldn't hear.
There is one more question through the chat. It appears that the research presented was on males. Can you explain why both genders were not included in the research?
The research was not specific to males. I'm not sure if there's, maybe there was a finding that I noted was specific to boys versus girls, but no, the research included all children, boys and girls. The research was predominantly with mothers, and perhaps that's what the person was asking about.
Well, so far, I don't see any more questions. The certificate of attendance will be provided after the event. Nevertheless, the link for the slides has been shared throughout the chat. If you're unable to find it or download it, we will be putting it up on our webpage. You can find it using the same topic for this training, and you'll be able to find it right away. Please remember to fill out our survey. This will help us continue developing other trainings similar to this one. As of now, we will be ending this training, but thank you so much, Dr. Calzada, for your time, and thank you so much for sharing all this precious information for all of us.
Thank you.
Thank you, everyone, for coming in today. Have a nice day.